Hello and good afternoon. This is Kuldeep Chaudhary from Health in India. I'm at Sheetla Hospital, which has emerged as the best hospital for mother and child and for pediatrics. The hospital, which was established 15 years back, has made rapid strides in the field of pediatrics, neonatology and gynecology. Today, it has a very strong department of gynecologists and pediatricians. There is a full team of 5 pediatricians who take care of all kinds of babies, whether they are premature born or young kids. The Department of Gynecology has Dr Anu Sidana and Dr Sheetla who take care of all kinds of pregnancies, the deliveries. Most complicated deliveries are being referred to the hospital because of the NICU backup. The hospital also handles all kinds of gynecological surgeries. Health in India decided to do an in-depth survey about the facilities available at the hospital and the kind of work that the doctors here are doing. I would like to focus on one more thing. Today, Gurgaon has specialized healthcare services at most of the top-end hospitals, which I prefer to call them as the big daddies of the Indian healthcare. But most of the quality healthcare is available in the most expensive segment, which is the 5-star segment. It is important for because a large population, a large part of the Indian population is in the medium range, belongs to the middle classes who cannot afford the high cost of the treatment at these hospitals. So Health in India has taken upon itself to not only identify but to promote the good work being done by the hospitals which are affordable for these middle classes. Today insurance also is suffering from very high claim ratios, and they are also looking at setups which do good work at affordable prices. In this attempt, we are here at the Sheetla Women's Hospital, and I am joined by Dr Anu Sidana. So let us talk to Dr Anu Sidana what kind of work is being done at the hospital. Good afternoon, Dr Anu. We would like to understand from you, you are a senior gynecologist at the hospital. What exactly is the kind of work that comes to Sheetla Hospital? This, of course, being a referral hospital, so a large number of healthcare facilities in and around Gurgaon are referring their patients. The most complicated cases come to you. So we would like to understand what kind of infrastructure do you have, what exactly are the procedures that you are doing at the hospital?
Obstetrical procedures over here, especially high-risk pregnancies, including especially preterm labor pain, patients having preterm labor pains, as well as any kind of obstetrical emergency, placenta previa and preeclampsia, abruption placenta, as well as we are dealing with all kind of obstetrical third-stage emergencies like different rupture, obstetric labor, and we are having all the facilities over here. We have a good backup of ICU here, and we are doing normal deliveries, caesareans, as well as hysterectomies, cesarean hysterectomy periodisis, as well as we are doing all kind of gynae surgeries.
Dr Anu, you are getting lots of these referred difficult pregnancies. According to you, what is one of the most major reason for these difficult pregnancies? We see, there are segments, there's a large number of migrant population in Gurgaon because it requires a huge labor force. So is it low hemoglobin one of the biggest reason for these complications in the pregnancies?
Yeah, it could be, because the population we are catering over here, they belong to low socioeconomic status, as well as poor antenatal care during the pregnancy they are getting, and that's the main reason we can say. But sometimes low hemoglobin, it is associated with other pathologies, because it could be the culprit for other major obstetrical complications, which can lead to, which can threaten maternal as well as fetal life.
Gurgaon has about 4 or 5 neonatal ICUs, and Sheetla is right at the top when it comes to not only the infrastructure but also the high quality of manpower that it deploys. So do you think there are large number of babies which are being premature, and what are the reasons for that?
Look, chances of preterm labor pains are associated with many pathologies. Many risk factors are there, and I think The most common cause is any kind of infection during pregnancy, and moreover the stress in this state we are suffering in metro cities. The chance of preterm labor pains can be because of lots of reasons. So right now to comment what is the main reason, I cannot say specifically. But no doubt infection, anemia, any obstetrical complication, they can lead to...
And coming on to the middle classes or maybe the more affluent classes, is the rising maternal age a cause for premature deliveries?
Yeah, it could be. But the chances of preterm labor pains, they could be in both extremes, either young or elder pregnant women.
And how much is the role for addictive habits like alcohol and smoking? Are they also important?
Any
cause?
kind of infection like smoking, tobacco, even caffeine. If we are taking more than 4 cups of coffee per day, they can lead to preterm labor pains.
Now, there are many infertility clinics that are abounding in Gurgaon, right from Vaughan Hall to all the major hospitals have infertility setups. So, deliveries that arise out of these IVF and IUI procedures, they also result in a lot of preterm babies being born.
Because all these cases are their high risk. We consider them as a high risk pregnancy. They're already what we call like every pregnancy is a precious pregnancy, but we consider them as a very precious pregnancy.
A lot of money has gone behind that.
Because one single cycle costs around 1.5 to 2 lakh to a patient. And moreover, some other factors are always there which can lead to preterm.
You must be getting most of these cases which are the complicated ones. There is a very big allegation amongst all these top-end referral hospitals that they unnecessarily do a large number of caesarean sections, and the ratio between caesarean to normal delivery is 90:10. What is the ratio in your practice at Sheetla Hospital between caesarean to normal deliveries?
Depends upon patient profile. The patients we are getting over here, they are usually high risk patients. No doubt at a referral center the chances of caesarean will be more, because patient is already at a complicated stage, they are coming to us. So we are dealing with more complicated cases, so chances of cesarean are there, but no doubt we are getting normal deliveries. The patients are being delivered normally.
And there must be more than 100 maternity centers in Gurgaon, but there are just 4 or 5 places which have adequate backup of a neonatal ICU. So what kind of pregnancies should actually land up at these setups like Sheetla Hospital, which have a backup of an ICU?
As I told you earlier, any patient having preterm labor pains, any patient having obstetrical complications like preeclampsia, severe preeclampsia, placenta previa, rupture placentae, which can lead to preterm delivery of the baby, any complication. Plus colitis of pregnancy because of any other medical illnesses leading to which can affect maternal as well as fetal health, and we need premature termination at any stage. Those, I think, Sheetla is the best place. Hard work of 9 months, you are following up the patient and you are getting a fruitful result in your hands, and that's give you some different kind of feeling which I cannot
Sheetla Women Hospital is also a specialized center for all kinds of gynecological surgeries.
Yeah.
So what kind of patients do you see the most? Because I was covering up some hospitals in a town which is very close to Gurgaon, and there hysterectomy is the be all and the end all of the world. More than 50 to 60% of the procedures on women care that are being held are hysterectomies. But here in Gurgaon, what kind of mix you get across all, myomectomies, hysterectomies, infertility?
We're getting every kind of gynecological patient over here, starting from minor problems like vaginal discharge to fibroid uterus, as well as uterovaginal prolapse, as well as patients who are having adenomyosis and any kind of cervical pathologies. And we are dealing with all these kinds of procedures over here, either minor or major. Minor, like we are doing polypectomies and DNCs, as well as major we are doing myomectomies, hysterectomies either abdominal, vaginal, or these days total laparoscopic hysterectomies we are doing here.
So you are assuring us that they will not only get quality outcomes but would be able to save quite a lot of money if they get their treatment done at the Sheetla Women Hospital.
Yes.
It was a pleasure talking to you, Dr. Anu. You have not only enlightened us about the good work being done at the hospital, but also about many of the procedures which we were not earlier aware about. We wish you all the best and hope that you continue to serve the humanity and your passion for life remains as bright as it is today forever. Thank you.